it really kind of hit us just like a brick. We didn't really, just Tim and I, both with our jobs, we just really didn't think it was going to happen to us. We have no family histories and, immediate family history that there's any breast cancer. So when we, noticed a difference, and she was like, oh, well, let's just do a mammogram. I know you're only 38, but let's just do it and get it ruled out. And so I really wasn't too concerned at the moment. I wasn't having any pain, or I never felt any lumps or anything. So I was just like, it's just an abnormality. It's not that big a deal. And then when I went in and had my mammogram done, they kept me there longer, and they said, well, we need you to stay. And so I thought, well, right away I knew something else was going on, but I thought, oh, it's not going to be that bad. I just kind of figured we'll just take care of this as it happens. And I stayed, and then they did another mammogram, and then they did an ultrasound, and then they took me back in another room and said that we needed to call a surgeon. And so we scheduled that we would have a biopsy done a couple days later, had that scheduled. It just kind of all worked a little bit. It all went really fast, but then we knew, they were taking good care of us, and had the mastectomy already scheduled like 10 days later. And we started going through everything and talking to our family, and it was just kind of really fast. But we were able to get in right away. It worked out. Really, if you have any questions at all about whether or not things don't look right, because I just thought I'm 38 years old, I breastfed my kids, this is normal, this is what you're supposed to look like. You just kind of have in your mind what you're supposed to look like, and I never felt any lumps, but just that when I talked with the doctor and I said, I think something else is going on, and just kind of went with my gut that I should, kind of push it a little bit more. And, even though at the moment she said, yep, this could be normal, but let's go with it. And I think that, that really, we both knew in our gut that we should just check it out. And so I think that's what I've just told people. I met a couple other ladies, and I said, if you have this, if you have, an inverted nipple, or if you have any changes in your breasts at all, go to your doctor. And I've talked to 2 other ladies that the same thing happened to them, and they made an appointment, had a mammogram done, were diagnosed with breast cancer. That wasn't going to happen. They were not going to make their doctor appointments before they had even talked to me. So that was just something that I felt like if you just have any question at all, you aren't always going to feel that telltale sign. You aren't going to always feel sick. You aren't going to have all those things that are in a textbook. That's just going to happen. So I just kind of felt like I feel better about telling people that all that you think, just go and have it checked out, and if it comes out nothing, then that's okay.